And next, I'm excited to welcome Dr. Zachary Higgins. So Zach is one of our first-year fellows, and he completed his neurology residency here at the University of Colorado. And we're excited to have him doing his fellowship here to become a movement disorder specialist. So Dr. Higgins is going to tell us about dizziness and Parkinson's.
Right. Thank you everybody for being here today, especially on a Saturday morning. Appreciate you all being here. Again, I'm Dr. Higgins, one of the first-year movement fellows, and I'll be talking about a pretty common symptom in Parkinson's, which is dizziness. So the learning topics that we'll kind of go through today are defining what dizziness means, talking about the specific type of dizziness that we care about primarily in Parkinson's patients, which is orthostatic hypotension, which is a big word that I'll describe a little bit later. Things that influence this, non-medication approaches, medication treatments, and then kind of final tips. So first, dizziness is a sensation that can produce different feelings in the body, often a sensation of imbalance, lightheadedness, or a sensation of either yourself spinning or the environment around you spinning. People might also report unsteadiness, like they may be rocking on a boat, um, might get other symptoms such as tunnel vision, blackening of the vision, while you're also feeling this dizziness. And sometimes people also might just notice feeling weak or like their body is heavy. There are three main causes. These aren't exclusively the only causes of dizziness, but these are the three main ones we like to think about. Orthostatic hypotension being the primary one we'll focus on today, which is low blood pressure with position changes generally. So going from laying down to sitting or to standing. Vertigo is another process that causes dizziness, and that's usually like a sensation of spinning, either primarily like the environment around you is spinning, and those are more often, that symptoms more often due to inner ear problems, and is usually brief and may not be necessarily associated with standing up. Usually more like head turns could produce that kind of symptom. And treatment for that's different. Usually physical therapy, where they can work on inner ear imbalance, can help treat that. Neuropathy, which is just reduced sensation primarily in the feet, can cause burning, tingling, is another cause of dizziness. And that might be more of just a feeling of unsteadiness when you're up and walking around. But usually people will also notice that they have reduced sensation in their feet. There are different treatments for that type of dizziness. Physical therapy can be helpful to work on balance, as well as certain medications to help with any kind of discomfort from that reduced sensation and burning. It's also important to note that other things can cause dizziness too, like panic attacks can cause a sensation of dizziness, but you'll notice other symptoms with that, including a sense of doom, feelings of panic and such. Let's talk a little bit more about orthostatic hypotension. It's a pretty common phenomenon within Parkinson's disease. About 30 to 60% of patients will experience symptoms related to this condition throughout the disease course. And what it means is just a reduced ability to adjust the flow of blood with changes in position. So how our bodies work is that when we go from laying down to sitting or standing, we adjust the flow of blood by squeezing the blood vessels to help push blood throughout the body, and that results in maintaining blood pressure as we're changing our position. Orthostatic hypotension is just reduced ability of our bodies to do that, so our blood pressures tend to be lower when we're sitting up or we're standing up. Sometimes the heart rate also doesn't compensate quite as well for those positions either. It's just another factor that's part of that. This can be a problem because that sense of dizziness related to this can lead to imbalance and falls, which can lead to bone breaks and other injuries, and that's something we want to avoid. This low blood pressure often produces symptoms such as the feeling of lightheadedness, that tunnel or blurred vision that I mentioned earlier. People also might just notice feeling more fatigued, or a generalized sense of weakness or heaviness throughout the body. Kind of new headaches that are persistent, especially if you're like kind of up and moving about, might be also another symptom of this. Slowed thoughts or thinking can also happen. And then passing out is that kind of like feared complication from this if the blood pressure gets too low, which could lead to falls. So this is sort of a scientific, like busy picture here, but it just shows you here on the far left side, that red structure is a blood vessel, and the blue lines are just nerves within the nervous system. And this is just meant that Parkinson's disease does affect some of the nerves that help regulate our blood pressure. So when those are affected, laying down, our blood pressure might be higher than it normally would, and then going to sitting or standing positions, our blood pressure might be lower than it should be otherwise, which can produce those symptoms. So things that can also worsen this, many Parkinson's medications, as Dr. Beeler had mentioned in the last talk, can lead to that lightheadedness or low blood pressure. Being on additional medications to help treat blood pressure, high blood pressure tends to be an issue that is commonly seen as people get older. So people are often on blood pressure medications, and those can also lower the blood pressure and contribute. Some mood medications can also contribute to low blood pressure, as well as water pills or anything to help kind of, if people have swelling in their legs, taking a medication to help reduce that can also lower blood pressure. Some kind of general lifestyle things that can also worsen these symptoms include not getting enough fluid throughout the day, lots of caffeine or energy drink intake. Just those contribute mainly because it causes people to urinate more frequently and lose water that way. And then large meals also stimulate different parts of the nervous system that can lower blood pressure. So there are lots of non-medication options and lifestyle changes that you all can make to help reduce these symptoms. One of them is just increasing the water intake throughout the day. We generally recommend for our patients more than 64 ounces of water. So that's generally like 8 glasses of water throughout the day. If you have any kidney or heart issues, it would be just important to confer with your doctor to make sure that it's okay to consume that much water. Sometimes those diseases have limitations on how much fluid can be taken. Limit coffee, tea to the morning, limit energy drinks, anything with caffeine would just limit to like one drink of those in the morning. Avoiding alcohol. Alcohol can worsen the low blood pressure. Increasing salt intake. Again, this is another important thing to ask your doctor about if you have kidney or heart problems, because sometimes salt can be a problem with those. There's compression stockings. Usually we recommend up to the thighs, and then abdominal binders. And here I have a picture of what an abdominal binder looks like. There are many different kinds of abdominal binders, and generally it's just meant to be a tight binder around your body that helps kind of just push the blood up to the heart. Other things that can be done include eating more frequent small meals, just kind of just helps reduce that sense, the stimulus to the nervous system that focuses on digesting food that can lower blood pressure. And then just taking your time, going from a laying position, like if you're just sitting up in the morning, just sit at the edge of the bed for a couple minutes, let your body adjust. There's some like exercises that can help with that, like lifting up the legs before you sit up, or kind of just moving your legs around a little bit can help stimulate that blood flow. And then if in the moment you're feeling that dizziness or lightheadedness or any of those other symptoms, drinking a glass of cold water can be really helpful to help increase the blood pressure. And here's an example of a picture showing how compression stockings work. So these ones are thigh high, and what they do is they squeeze the legs. And in this picture on the right, it shows a blood vessel, and it's just that pressure on the muscles and that blood vessel help push blood up to the heart, which can help pump it through the rest of the body. Thanks. If those things are not working well, those kind of non-medication options, there are medications, many of them, which can help increase the blood pressure. So it's important to review current medications that you might be on. Sometimes people need to reduce or stop their blood pressure medications if high blood pressure was an issue in the past. Sometimes reducing Parkinson's medications as needed. And then here's just a list of many of the common medications that we can use to increase blood pressure to help with that. So if making lifestyle changes aren't enough, there are medications that can help. Treatment issues, sometimes people complain about having increased urination because of drinking too much water. You can mitigate that by just spacing it throughout the day and limit intake in the evening. And high blood pressure can be a problem with some of the medications, especially when laying down. So they do make pillows, for example, that can increase your head at night, that can reduce that issue. So the main takeaways, it's just orthostatic hypotension, meaning low blood pressure, when going from sitting or standing is very common. Many medications can worsen this. There are things that you can do in your own life to help mitigate these symptoms, and there also are medications that can be helpful. And this is just a picture of a 64-ounce bottle of water, so they do make those size water bottles. And then I think we have a couple minutes for any questions.